everyone, this is Casey, and the following video is about pancreatitis.
So Kim, Casey's telling me that Zeke has been acting just not himself. You know, we call it in vet medicine, ADR, ain't doing right. Is that how you feel?
That's exactly how he is right now.
Just not quite himself. He's
just weird, like, and just not wanting to play with the other ones, and
with Manny.
just
Manny's such a
Manny's
great
doing
guy,
all right, but he doesn't know what's going on.
Right.
But he's definitely weird right now.
Okay, and Casey said that you told her that his appetite is kind of on one day, off the next day. He's just laying around, just not himself. And she said it's been going on for the last, what, 3 to 5 days?
Yeah, at least. Like, I think I started noticing something funny like last week, and now it's definitely rolling into, he's definitely, there's not feeling really well at all.
Casey also told me that he's not drinking excessively or urinating excessively. They're both strictly indoors, so you keep an eye on the litter box, and you're not scooping it more frequently. He's just not right, ain't doing right.
Right, no, nothing like abnormal. But just, you know, watching him, I'm thinking something's off.
Something's up. Well, I think you're on to something. Okay, and not to worry too much. I mean, we've got some changes, but there's lots of things we can do here. But I feel the bottom line, I'm going to go over this. I think he's got pancreatitis. It's a really common problem in cats. It's one of these diseases that's often missed. It's hard to diagnose because they're just not doing right. Unlike dogs come in and a lot of them are really painful in the abdomen. They're throwing up. You can smell them coming into the clinic, okay, based on their symptoms or clinical signs. With cats, it's really hard sometimes for the owners to say, gee, I think he's really sick. I just think maybe he's having an off day. Maybe he's got a migraine. I don't know. And his physical, you know, no big deal. I felt maybe a little bit of discomfort in his abdomen when I examined him, but nothing to hang your hat on. I mean, he hasn't lost much weight. His weight's down just a tiny bit, but his color's good, everything else, all his vital signs are good. He's not running a fever, so the blood work has really helped us out this time, and I'll explain why. He's got a few mild changes on his CBC. This monocyte count is up a little bit, meaning maybe there's some inflammation going on, but that's the only really significant finding on his CBC. When I show you on this page, now I don't want you to panic with all this red stuff, okay, because it's no big deal, and I'll explain why. We're going to keep an eye on it to make sure it's no big deal. So the one thing I'm concerned about, Kim, is this abnormal SNAP FPL. Okay, this is a test that we use as a screening test for pancreatitis. When it's abnormal, it says maybe it is pancreatitis. The pancreas could be dragged along for the ride. It might be secondary. And we're going to send some blood out to the lab. Okay, it's called a SPEC FPL, which will give us more information. It's a corroborative test. It gives us an actual number rather than abnormal versus normal. Now, the other thing I'd like to do is some imaging studies. I'd like to get an x-ray and potentially an ultrasound of his abdomen, because pancreatitis can be primary in cats, or it can be secondary to something else. Okay, something like getting into something that he shouldn't have. You know, sometimes they have irritable bowel or inflammatory bowel disease. The pancreas is really tightly associated with the liver and the intestinal tract. Okay, so if something goes wrong with one of those organs, then the pancreas can get dragged along for the ride. So it's not the primary issue. I really think it's the primary issue here. And these things in red, where I didn't want you to panic, and sorry for that, but his liver enzyme is up a little bit. Another enzyme, the GGT, which is more specific for the biliary system. And the bile ducts connect the liver to the small intestine, and they go right by the pancreas, right through it. So when the pancreas gets inflamed, those things can be driven up secondarily. So this all kind of makes sense. Same with this bilirubin. The medical term for this is cholestasis, okay? And, you know, it's a big fancy word, but it just means the bile is not flowing the way it should. But he's not jaundiced or anything like that, and he seems, you know, pretty good overall. His other vital organs, these are the kidney enzymes. They're great. His protein levels are great. His electrolytes, his calcium. So we're doing really, really well. He's certainly not hyperthyroid, so there's a lot of good news here. His urine's good. It's nice and concentrated. I feel his kidneys are functioning really well. So we need to do a little bit of testing on Zeke, okay, a little bit extra testing to try to, you know, make sure that we're not missing anything that might not be pancreatitis. But I'm pretty confident he's going to turn out to have pancreatitis. Now, the good news is, you know, through dietary modification, in case he's going to go over everything with you, and some medications and so on and so forth, you know, the prognosis is very, very good. But we're going to have to watch him. I want him back in a couple of weeks. We're going to repeat some testing. And I want you to watch him very closely for any of these ADR signs, okay? And you being a very dedicated cat owner, you're going to know when Zeke's just not right. You know, he's usually fighting with Manny. They're tearing around the house. Right. If that's not happening, you need to bring him in sooner than later. Okay? Any questions about pancreatitis? We have a nice brochure we're going to give you that explains it further. And if you have any other questions, you know, you always call us. Either I or Casey will call you right back.
Yeah, I think I'm okay. I'll take a look at that, but then I can ask Casey too. So
great.
Awesome.
Awesome. Thanks for bringing them.
Thanks.
It was great.